Well, it's been over a week since the mask mandate was lifted in Dane County.
Has the number of COVID cases risen since then? Well, let's find out from Dr. Zorba Paster, who joins us from his home office this afternoon. Hi, Zorba.
Hi, good to see you guys.
Good to see you. So how are we doing here in Dane County?
I think we're doing okay. Just as expected, a lot of people are taking off masks in different places. And as Mark, we just talked, went to Pick and Save. Everyone was wearing a mask in Pick and Save, so you sort of wore it. I think you've got to use your own judgment at this point. A lot of us will be on masks, but if I'm at a grocery store shopping, I'm going to be at Woodman's, I'm going to wear a mask. Why? I'm just around people, and it's easy to do. On the other hand, if I go out to a restaurant and it's a restaurant that I like, I'm probably not going to wear a mask anywhere in there.
So where do we go from here?
I think we live with it. I think right now, many of us have been immunized. I'm not sure what the exact numbers are in Dane County. It's certainly above 75% have been fully immunized. Most of those people have been boosted. I think Omicron did a great job of basically immunizing a lot of people because it came through. Some people, of course, perished from it, so it was awful. But I think right now it's something we're going to live with, and it's going to be around with us. And every year, maybe we need a booster, just like we have an influenza booster. Let's not forget, flu numbers are down. 30 to 40 to 70,000 people die a year in the country from flu, and I think it's going to be a combination of influenza and COVID, and it's probably going to be seasonal.
Interesting. So it's something we're just going to learn to live with.
We're going to live with it just like we do with influenza. And I think you've got to use your individual judgment. If you're on chemotherapy, if you're on prednisone, if you're at risk for a serious disease, mask up when you go out. What's the big deal? On the other hand, if you don't have any of those risk factors, I think it's finally time to get out there and actually see each other's face. So when somebody says, hi, how are you? You'll know who they are.
Yeah.
When they're behind a mask, I don't know about you, but sometimes I didn't know who was saying hello to me.
We've had some employees start within the last year, and we've never seen their faces until last week.
Right.
Who are you?
Yes.
All right, it's time to get your medical questions answered. Dr. Paster is taking your calls at 608-270-9933.
Call in right now, and we will get to your questions when Live at 4 continues. And Dr. Zorba Paster rejoins us now to take your calls. The phone number to call right now, 608-270-9933.
And we have lines open, so call in now. Let's start with Dale from Clinton. Hi, Dale. What's your question?
Hi. I'm taking injections in my eye for macular degeneration, and I've heard that that can lower your immune system.
Well, first of all, it may, I don't know how much it affects your immune system, but if it does, it's very, very minimal. And even if your immune system were lower, you should definitely be immunized. Remember, you've got to make sure you get your booster. The messenger RNA, the mRNA, is not a virus, so it's not anything live. So even with people with a reduced immunity, should definitely be immunized.
Okay, well, I have been that, so, but I'm just curious. Thanks very much.
All right, thanks for the call.
Zorba, I have a question for you.
Sure.
What is going around that's not COVID related? Because there's a lot of sore throats, coughing, et cetera. My kids' school, they have a weekly newsletter that says how many people had COVID this week, and we had 0 cases, but they said alternately, they're seeing a lot of the regular stuff.
You bet. What happens is, at any time, there are 10 to 20 rhinoviruses, viruses that affect our nose that are simply going around. And what we now know, because we know this from COVID, is that many people who have these viruses, they're not symptomatic. And so they pass it on to other people without realizing it. So the answer is lots of different rhinoviruses. And it's all because we're still inside, even though we're masking up, we're passing it from person to person. So the answer to this is warm weather, get outside, and that's what we should all be doing. But the answer is they're just the viruses that are typically in March and in April that then tend to disappear. Seasonal viruses.
Okay.
All right, let's go to Jack now in Stoughton. Hi, Jack. What's your question?
Yeah, according to the New York Times yesterday, there's still 1,500 people a day dying from COVID. That's about 10,000 a week. That is hardly inconsequential. Granted, Dane County is fairly sophisticated and is on top of things, but it seems to me that there must be some pressure, not just from the truckers, though I wouldn't think that they should be making public health policy. What do you really think it's time to let our guard down with 10,000 people a week still dying?
I think I followed the CDC in saying there is a time that we actually have to start really opening up society, and that we have to look at the spots that are the red zones. That's where people are actually dying. And in that case, there may be certain areas where people have to mask up. But we've got to look at the broad picture. And the broad picture is things have opened up, and so it's time to begin to open up society. Yes, I fit with the CDC. I think it's a good idea, and it's a very local thing. So right now in Dane County, we're fine. In Maine and in Idaho, they should continue to mask.
All right, and we have Beverly from Janesville. Hi, Beverly. What is your question?
I've had all my shots, and I've had COVID 2 years ago, but I don't have the booster. But I got through the COVID pretty good, but now it seems like months later, I'm having all these problems like falling down and foggy memories and stuff.
Sure.
And I was wondering if that had anything to do with COVID.
Well, first of all, it might have something to do with COVID, but it might have something to do with something else that's going on. So this is a good time. Call your doctor, make an appointment, see somebody, because you're going to have diabetes, hypertension, other things that may be handling there, especially since you had COVID in the past. So I wouldn't simply say this is long COVID. I would say this is the time. See your doc, see if anything else is going on in addition to that. And you need to be boosted. You need to have all 3 shots at this point to be protected.
Get that booster. All right, we thank you all for calling in. We'll do this again next time. Zorba, thank you for your time.